Hey, this is pharmacist Curtis Alexander. In this video, I got a question from a reader that I thought was a good one and wanted to cover, and that was a woman who asked me about using Flomax to help pass kidney stones. It's an interesting question because Flomax is primarily used in men to treat prostate issues. That's what it's FDA approved for. So that's the first point I want to make, is that using Flomax in women or even in men for kidney stones, it's not approved. Now that doesn't mean it can't be helpful, okay? So the one thing we do know is that there have been studies that have looked at using Flomax for kidney stones, and the data was actually pretty positive. It's limited, but it does appear to help. And in general, what we find is that it sort of depends on the size of the stones. Okay, so if it's kidney stones are small, obviously, so less than 5 millimeters when they gave Flomax to those people, it didn't seem to help very much because they're smaller stones. Usually those can be passed. The sweet spot for using Flomax was stones that were 5 to 10 millimeters in size, and it did help those people pass those a little quicker and with, I don't know, necessarily less pain. I mean, it's extremely painful to pass kidney stone, but it did help speed up the process in that 5 to 10 millimeter size of stone. Anything bigger than 10 millimeter, it sounded like they usually had to go in and ablate or kind of break those stones up sometimes. So it may be helpful, but the data is kind of mixed once you get bigger than 10 millimeters. So as far as using Flomax, yeah, it seems to provide some positive evidence, but it really depends on the size of the stone. So that 5 to 10 millimeter is really our sweet spot. What about safety? Because anytime when you're talking about using a medication in women, granted the woman that asked this was not of childbearing age, but we have to discuss that because younger women do get kidney stones. What about pregnancy? What about breastfeeding? Those sorts of things. Again, our data is limited. We have some animal studies which didn't show really any difference, any negative effects towards the fetus. But again, those are animal studies, so I don't put a lot of weight in those. We do have some data going back and looking at women who used Flomax and were of childbearing age. There didn't appear to be any negative side effects, but this is something you're really going to want to talk to your doctor about, obviously. But from the limited amount of data we have, it does not appear to be harmful. But again, talk to your doctor. And side effects, I always like to talk about side effects. Obviously, when you have kidney stones, the main thing on your mind is to pass them, get the pain over with. So virtually any side effect that you're going to get from the medication is going to be worth it in the end run. But what you're looking for, dizziness is going to be a big one. Flomax acts on receptors that can cause your blood pressure to go down, particularly when you stand. So watch out for dizziness, weakness, and headache. But again, dizziness is the main one. So to answer the overall question, really for men or women using Flomax for kidney stones, depending on the size of the stone, I think it's worth serious consideration between you and your doctor. Again, depends on the size. The kind of wild card is there's not a ton of data about pregnancy or breastfeeding using it during that period. But from the limited data we have, it appears to be safe. But again, talk to your doctor. So I hope this video was helpful. Hope it was valuable. Make sure to subscribe, like the video if it was. And until the next one, this is Curtis Alexander. Thanks.